national health insurance scheme. They're talking about implementing parts of it by 2012. And the numbers that have been put on the table is that will require around 11 billion rand more to start implementing the NHI by 2012.
Yeah, I do believe that's an understatement. I think you'll have cost overruns very, very quickly, and multiples of it. In other words, that you're going to end up with something that's going to be costing hundreds of billions ultimately to actually have it running to any reasonable degree of properly. And I think the one concern that I do have is that we're not really fixing anything. It's like building the Gautrain but not fixing Metro Rail. In other words, existing structures. So it's the same thing here, is that our hospitals, our public hospitals, are not semi-dysfunctional in many instances because of the lack of resources. Natalspruit Hospital isn't filthy dirty because they lack cleaners, for instance. It's budgeted for, they have them. You know, there's no bandages in whatever hospital, not because it wasn't budgeted for, but because somebody didn't order it and somebody didn't deliver it, or it was stolen, or whatever the case is. In other words, the managerial systems and the effectiveness of management in our public health system needs to be sorted out and overhauled first, right, with people that are skilled and competent, before you actually start throwing resources at this.
And of course, these are very relevant points. We're talking about misallocation of various monies, and we're talking about mismanagement as well. But at the end of the day, the ANC has been very vocal about bringing this to the fore relatively soon. They're talking about 2012. Let's start off with why you think, Ulrich, there is such a big urgency to get this done. Do you think it's, we're seeing some political agendas coming through, or do you think that we are going to start seeing sustainable and a massive difference when it comes to the healthcare scenario in the country, to try and get people access to healthcare? Do you think that is the ultimate agenda?
You know, I think that surely there is some political agenda as well in this. And it's to tell people, well, you know, we're going to deliver even more on your behalf. And really, if I look at this, then first we have to get, as Chris has actually said, you know, we have to get the current system working properly. And therefore, if we look at this, then I would say it's a wishful thinking, for example, that the economy can grow at 7%. So if we look at that, then the cost of this system, is that really affordable to the South African economy? And then, of course, I think it's also part of the bigger sort of social welfare system that, you know, we're implementing in South Africa. And really, one would rather have people being in a position where they can earn a living by working than being dependent on social welfare benefits or the national healthcare system.
Right, it's expected that the NHI is going to cost around 376 billion rand by 2012, and that's in real terms. In nominal terms, it could rise to around 574 billion rand. And then you also have to start bringing into consideration wage negotiations on a yearly basis, and it's really going to cost the country a lot of money. The question is, can we afford it? Because that's what it really boils down to. And I think countries that already have implemented national health insurance, I mean, look at what's happening in Britain. We're seeing massive budget cuts as well, and a developed economy like that cannot even sustain a national health insurance scheme. So how can South Africa sustain it?
What I believe is that we're doing is we're fitting effectively a developed economy cost structure on top of an emerging market tax base, and there's going to be a misfit, and that comes at a time that the developed world are actually struggling to find these systems affordable. The UK at the end of the Second World War implemented national health. Unfortunately, it becomes political suicide to even remotely touch that. So that stays in place, and you've got to cut other areas of the budget that's less politically sensitive. But the problem is the more people you bring onto the public teat, the more difficult it is to get them off it later, especially when you find it unaffordable. And that's the joy of South Africa. We find ourselves in much stronger position than countries like the UK, US that are heading down paths of bankruptcy. And South Africa, Brazil, India, etc. are actually on a completely different growth path. We can take ourselves on the same path of bankruptcy very, very quickly if we raise our cost structures too quickly.
Because essentially what we need to do, we need to see a 7% growth for around 13 years to be able to fund this. So what if there's another double dip scenario that plays out, or a recession that plays out on a global level? I mean, we saw what happened. We hit recession in the country. I mean, even though we're an emerging market country. So Ulrich, a very big gamble that the government is taking on.
You know, if Chris has mentioned what's happening in other countries as well. And if we look at what happened in Brazil, you know, when the President Lula came to power 8 years ago, I thought, you know, but he's promising everyone everything. But over the period 2001 to 2008, they quadrupled their export of commodities. What did we do? And therefore, you know, if I look at our situation, then I would rather say, but let's throw this money into really developing our infrastructure so that we can get the coals to Richards Bay and the coals to and the iron ore to.
So we are starting to see delivery. In other words.
I tell you, the bigger problem with national health is one always needs to understand. Lesson 1 in economics: there's scarce resources. So if I've got a salary and I'm spending it on X, right? If 2,000-3,000 rand gets yanked away from me to pay for national health, which is what will be the case. It's going to escalate the cost structure enormously. There is less to spend on something else. So automatically you will find that some sectors will actually experience recessionary or near recessionary conditions as a consequence of implementing this act, because of the shift that's going to take place in discretionary spending.
Well, you know, Ulrich, also just touching on the fact, I mean, I think it's a very important point that if you start allocating a lot of resources to one element or one division of the economy that's going to start sapping up quite a lot of your money, then you're not going to be focusing on education and job creation and all the other things. So, and we know that those are also very big priorities. The question is, what is the biggest priority for South Africa right now? Off the top of my head, I would say unemployment, and we need to tackle that.
Yeah, and ironically, unemployment and education help solve health problems.
Yeah. And then on the other side, you know, what is going to happen to our tax base in South Africa if we have to finance this healthcare situation? And you must also keep in mind that if you want to be competitive in luring the international investor to come and do business in South Africa, you have to look at your tax structure in South Africa. How competitive are you by way of taxes?
Yeah.
Compared to other countries.
We're competing with Dubai, that's got 0 personal taxes, for instance, and Brazil, which has got much lower personal tax than we have, etc. So we need to be very careful that we put ourselves in an uncompetitive position.
All right. Also just touching on the fact that the tax scenario in South Africa, we pay a lot of tax as South Africans. So I would assume that the tax, is also going to start increasing dramatically, surely to start funding this. Because Chris, as you alluded to, we're going to get into a very dangerous black hole that should we not be able to fund it, or something happens on a global level, a very bad scenario plays out, then the government cannot pull out of it as easily as one would hope, as is what is happening in the UK. So Ulrich,
Yeah, no, it's actually a path where you should not go to. Unless you're very sure that you can have the 7% growth rate and you can have the funding of this system on top of all the other demands that this economy has to develop this economy and to create jobs in South Africa.
It represents a quantum leap in our tax base, but to do it, to generate the 7% growth, there are things that then have to happen, and that means the tax structure has to be radically overhauled so that savings and investment can avoid tax. In other words, things like tax on interest earned and tax and capital gains tax, the two principal massive growth killer taxes, if you like, need to be scrapped, because if we need to fund growth of 7%, we need an investment rate of 25 to 30% in the economy, which means you need a savings rate of 25 to 30%.
To end off, clearly it is on the government's agenda, and they are talking about starting to implement this by 2012.
Yes.
As investors, as people in the investor community, do you think it's going to happen? Do you think that we're going to start seeing this rolling out, or do you think that it's just talk at this point in time? Because they've come out with budgets, they're talking about it at the National General Council meetings, and it seems that a lot of people are concerned that it is going to come to the fore.
I hope that reality really comes to the fore and that this only stays a wish list, because I'm afraid if we go down this path.
Buy Aspen, buy Netcare, sell Mass Smart and Checkers and Pick and Pay. That's what it is, because that's what the shift in expenditure will result.